I'm going to go ahead and let us take a listen.
Unbelievable work to help us all navigate through the situation we're in. First of all, I'd like to announce that the City of Peoria and Peoria County, along with Woodford and Tazewell counties, will issue a disaster declaration on Wednesday, March the 18th. The declaration is a mechanism to reimburse the cost incurred for the planning, preparation, and fight against COVID-19. It also helps with the costs for recovery and rehabilitation. It allows our organizations to assess how we provide services during this time and make changes if necessary. It's really a mechanism to really flip the switch and help us start the accounting process. Regarding the last point on changing services, as of Wednesday, the March 18th, all City of Peoria and Peoria County buildings will be closed to the public, allowing only staff to enter to do necessary work for the public. Taking this step is one important preventative measure to protect our staff while allowing us to continue our services. Let me reiterate, the staff will be available by email or phone to do their in answer to the public, but the public will not be able to enter the city and county buildings. The city and the county are both looking at electronic options to keep our board and council meetings scheduled, and more information will be coming out from individual agencies with specifics regarding individual departments. The City of Peoria and Peoria have posted this information on our websites. I want to reassure everyone that we're coordinating with the many area partners to ensure that people are getting what they need, especially our younger people, and that they're getting meals, they're getting the food that they need. I'd like to thank Beth Kreider and her Mass Care and Peoria County efforts to coordinate that food delivery. Information on that can be found on Facebook at Mass Care in Peoria County. And I've said this many times in the last few days, but we're a very giving and compassionate community. If someone wants to donate financial resources, please go to the home page of the Community Foundation of Central Illinois. A disaster relief fund has been set up there, and their home page is communityfoundationci.org. The situation continues to change quickly. I would advise everyone to refer to the Peoria City County Health Department website for continually updated information. If you have questions, you can also call 211. I know this is an uncertain time for all of us. Please continue to check on others. Phone calls, check our at-risk population, and please continue to take all preventative measures within your control to protect yourself, our community, and the healthcare workers who are working around the clock to treat our neighbors. We appreciate the public's understanding as we work to navigate the situation and respond quickly in order to protect our staff and the public of whom we serve. Now I'd like to introduce Monica Hendrickson from the Health Department.
Thank you, Mayor Ardis. I would like to actually begin by thanking our community as we work through this response effort. There are changes both weekly, daily, hourly, that require us to rapidly respond. The community's understanding and support has been wonderful for those of us working on the front lines. The current total case count for the Tri-County regions of Peoria, Tazewell, and Woodford County is as follows. 4 total confirmed cases, 2 additional from yesterday, all of whom are self-isolating at home and recovering. 11 total negative tests, 6 additional from yesterday, and there are currently 21 tests pending from our region. When we discuss our testing capability and capacities, it's important to recognize, as was discussed in the governor's address, that when it comes to coronavirus, this is a novel virus, and our testing is specifically related to COVID-19. There are already coronaviruses in the community that are routinely tested upon respiratory panels. Those are not the same as this novel virus, and as such, make sure that when individuals are communicating their status of whether they are a positive case or their concerns around that, that we're really specifically talking about COVID-19. With that, I'd like to introduce Dr. Stoner, who can also talk about additional respiratory precautions we can take.
Thank you, Monica. I know we've all heard so much about hand washing and social distancing and closing of events and everything else taken as public. I really wanted to talk today about what we can control, and because there's so many things that we can't control. What we can control are preventing certain diseases. And so there are many people that need to have a pneumonia vaccine. Particularly our elderly, people over 50 with a chronic medical disease, or people definitely over 65, even if they're totally healthy, should have a pneumovax vaccine that protects against 23 different kinds of pneumonia. And a flu shot, it's, believe it or not, still not too late to get a flu shot for those people who didn't get one on time. It looks like the flu season is going to extend into late April, and so getting a flu shot now will still protect you. Also a Tdap vaccine, tetanus, diphtheria, and pertussis, particularly protects you against whooping cough, which if you have whooping cough and COVID-19 would be a really significant disaster for your health. And having one respiratory disease doesn't prevent you from having another. You can have two things at once, and that can really lead to a problem. Then I'd like to focus on some other kind of chronic medical conditions that you really can affect. So people that have underlying persistent asthma and they're on regular daily medicines that they should be on, oftentimes skip their medicines when they start to feel a little bit better, and now is not the time to do that. Take really good care of your asthma. People with emphysema, chronic bronchitis, take your medicines as prescribed, and if you're really not up to your best, contact your doctor and see if there's things that you can do to even improve your lung function. People that have congestive heart failure, again, if you are not optimized in your care of your congestive heart failure, you need to let your doctor know and see what else can be done to make you better. When we talk about the elderly becoming really vulnerable, it's people that have these coexisting diseases. The last that I'd like to talk about is diabetes, because it's so common. When someone's diabetes is out of control and their blood sugars are high, they truly do not fight off infections as well. The white blood cells just don't work as well, and so people get more and more infections. And so a diabetic who gets COVID-19 is more likely to have a much more severe case. So those are things that we can control. So now is the time to follow the advice of your physicians and work on making certain those diseases are optimized. So thank you.
As Dr. Stoner spoke, there are many things that consider a person at high risk in terms of those comorbidities. And with that, this reiterates the importance of such things such as visitor restrictions, limitations on bars and restaurants, social distancing, minimizing gatherings to decrease transmission opportunities. And with that, the coroner, Jamie Harvard, would like to discuss additional restrictions that are now being placed within funeral homes.
Good afternoon, everyone. With me today is the president of the Illinois Funeral Directors Association, Greg Henderson. My office, as well as other members of the association, met this morning to go through our cognitive plan regarding how to move forward with anyone that potentially passes away from this disease, and or people who have services planned for funerals today and moving forward. So with that, I'm going to step aside and let Greg Henderson speak to our release from this morning.
Good afternoon. Our recommendation from the Illinois Funeral Directors Association is based on the CDC recommendations that gatherings should have no more than 10 people, which this unfortunately affects a lot of families. Funeral directors across the area will work with families to try to accommodate their needs. We recommend to have embalming when they want to have a viewing such as before cremation. And we are recommending to have private graveside services to accommodate that need at this time. And then in the future, when things, there's some normalcy to everything, then we would recommend possibly doing a memorial mass or a memorial service at that time. Any questions on that? Okay, thank you.
Understanding that these are difficult times for adults, it can only be imagined what some of our youth and our children in our community are actually experiencing. So with that, Dr. Bender, president of Unity Place, is here to discuss what we can further do for youth mental health.
Thank you, Monica. Good afternoon. Children and adolescents react in part to crises and disasters such as the one we're facing today based on what they see from the adults around them. When parents and caregivers deal with a disaster calmly and confidently, this is how we can prepare and provide the best support for our children. People become more distressed when they see repeated images or continue to hear about these disasters in the media. Consider limiting the amount of exposure your kids are getting to this disaster if you're one of those type of people that watch the news cycles 24 hours a day. I can relate to this specifically over the course of last weekend when I had the news coverage on and my son started looking distressed. And I asked him what was wrong, and he said, "Daddy, I don't want the virus to get me." I realized in that moment that he was being exposed to this again and again because I was watching it for hours. I turned off the television, I went back to another activity with him, and he started feeling much better. And this kind of really is what cued me into this piece of this. Separation from school, family, and friends can create a great deal of stress and anxiety for children. And this is exactly what we're dealing with right now. The emotional impact of an emergency on a child depend on a child's characteristics and experiences. I'm going to list several of these factors that may impact a child's reaction to these type of disasters now. Direct involvement with the outbreak. So if a family member or a close friend has contracted the virus, this may impact how a child reacts to it. Previous history of trauma is a common trigger, a common occurrence for any type of disaster. Well, we often see exacerbation of symptoms in kids and teens.